If you've had a facelift within the last 5 to 10 years and signs of aging are starting to show again, there may be options for you, such as a revision procedure. So the first question is what is a revision facelift? For the most part, it is what it sounds like. What that means is patients who have had facelifts in the past have not only had an incision made in front of the ear that goes into the hairline and then proceeds to go below the ear lobule itself, behind the ear and into the hairline. In most instances, that's a typical facelift incision. Some patients may have also had an incision made underneath the chin at the same time, incorporated as a part of their facelift, but in my practice, I refer that as addressing more the neck or a neck lift. It's in those situations that patients could have developed laxity over several years, and they want to have a more refreshed look and address those areas of concern. With a revision facelift, you essentially, if the incisions are placed in the correct area, they should be barely visible. And for the most part, I tend to follow those old incisions so that way new incisions don't have to be recreated. And if the area is healed up well from the first procedure, then normally it should heal up nicely as well. Now, with some revision facelift procedures, the incisions may be more visible, and it's in that situation that I will tend to maybe adjust the location of the incisions so that way we can make them less conspicuous. So what are the common signs that patients are coming to me to seek out a revision facelift? And normally the more common areas that patients are starting to develop as we age is you start to get a bit more jowling. You can also start to develop some laxity in the submental area. And when that occurs, you start to develop skin bands, and that leads to what we call blunting or loss of the angle between your chin and neck area. In addition, you can also develop what's called platysmal banding, where the platysmal muscle starts to show. And normally it's those signs of laxity, again, along the jawline, the neckline, or in some instances there's increased fat in this area that you may be seeking to get a revision procedure. One of the more common concerns that patients inquire about when it comes to a revision procedure is scarring. Scarring, it should be something that should be minimal if the incisions are designed and closed appropriately. But your risk for having increased scarring with this second procedure is no different than it should have been for the first. The other concern patients have is looking overdone or, pulled too tight. And as with the first procedure, if done correctly, you should be able to achieve a natural, more youthful look and not look over tightened per se. Patients also inquire about, is my risk of infection increased because of having a revision procedure? And just like with the first one, your risk of getting an infection is not increased when you have a revision procedure. The other part that patients are often curious about is the recovery. Is your recovery change because you have a revision procedure? And the short answer to that is no. With whether it's the primary or a revision procedure, the protocol is going to be the same, in which you're going to be wearing a garment and wrapped up, for the first 24 to 36 hours. And then after that point, you'll follow through our post-op protocol as you would with any other primary facelift surgery. How is a revision facelift different from an original or initial facelift? So one of the more common challenges when doing a revision facelift is camouflaging the incisions. And specifically what I'm referring to is patients who have had a facelift in the past where they had too much tension on the incision lines. They can sometimes develop widening or thickening of the incision, lead to scarring, which is, basically a scar is a visible incision. In those situations, we can design and develop a treatment plan to try and make those look better or less conspicuous. Certainly the goal is to make it so way they're barely perceptible at all, but sometimes what the end goal is to make a scar from being big and quite obvious to being a little bit less conspicuous. Another thing that sometimes arises in doing a revision procedure is patients have had a procedure done where their ears appear a bit pulled. It's what's called a pixie ear deformity. And as with the widening and visible scars, that too can be corrected. And typically the best way to correct that is to have a revision facelift procedure. Ultimately it's going to involve us meeting and looking at what you have and trying to develop a treatment plan that I feel confident we can achieve for you. Let's say you're unhappy with the way your facelift's turned out after many years and you necessarily don't want to have a revision procedure. Are there options available to address that? And the short answer is yes. In some instances, patients may be a candidate for having some filler treatments to kind of give the face a little bit more volume and areas that had become hollowed. That can certainly make people look a bit more refreshed by essentially changing reflection points and where light hits the facial area. Another instance will be as if you have scarring, for instance, that's visible, and can you improve that? And it really just depends upon where the scarring is and how significant it is. But there are times where this can be improved upon. The other modality that can be utilized for patients wanting to look refreshed but not necessarily have a facelift, you could also consider an option such as laser resurfacing. That helps improve the appearance and the texture of the skin, which certainly will make somebody look a bit more refreshed and can kind of help a facelift that you're not happy with look better.